Hamitakiapi, Leampetu Washte. Welcome to this special edition of the ICT Newscast. I'm Shirley Snavy. Healthcare is of great concern to many in a period of great change. ICT Managing Editor Jourdan Bennett-Begaye convened a panel of experts to break it down. Take a look.
Hello, friends and relatives. Jourdan Bennett-Begaye and Kia Ani Majishkishi Bashichi, Nakadene Dasache Oze Tachini Dashanella. I'm Jourdan Bennett-Begaye, managing editor of ICT. And so much for joining us today. I'm really excited to talk about all things health, public health, and policy, especially under this new administration with our expert panel. First, we have AC Locklear, CEO of the National Indian Health Board, followed by Abigail Echo-Hawk, who is the director of the Urban Indian Health Institute. And then we have Dean Seneca, CEO of Seneca Scientific Solutions. And thank you so much for all of you for being here today. My first questions to all of you. So in the second term of the Trump administration, and so much has happened from the Indian Health Service layoffs and to those being rescinded, medical research grants being canceled, and just everything across the spectrum that we'll get to later in the discussion. And all of this under Robert F. Kennedy Jr., who's the Secretary of Health and Human Services. What are your initial reflections on the impact of the policies so far, and how has it affected the work each of you do every day and who you serve? I guess AC, you can definitely start us off.
Awesome. Thank you, Jourdan. Thanks so much. And thanks for having us. At the National Indian Health Board, it is our mission to advance health and well-being for American Indians, Alaska Natives through policy and advocacy. So these decisions and every decision that any administration makes is, really critical to our everyday work. But, with the changes at the beginning of the administration, it led to a lot of uncertainty for a lot of the tribal nations. It led to a lot of confusion. Tribes really depend on a lot of these funding mechanisms to really help advance the needs of their people. So with a lot of the funding freezes, potential staff cuts, it really left tribes in a place where they didn't know if they were going to be able to continue a lot of that funding or a lot of this programming. And for us, that means that we were constantly working with our partners, constantly working to educate the administration, educate Congress, get folks on board to make sure that we were exempting tribes from a lot of these policy decisions. And something we'll probably talk about a lot today is what makes this a little bit different is the federal government has a trust responsibility to the tribes that's different than any other population. And these programs are essential to upholding that trust responsibility. So any of these decisions without consultation of the tribes is a violation of that responsibility. So it really has been about really educating those, protecting those programs, and really holding on to what we can and making sure that we're keeping tribes unharmed.
Abigail, did you have anything?
Yeah, so thank you so much for that question, and thank you for the invite to be part of this incredible panel. And I hold a really unique position. I hold two positions. One is the Executive Vice President of the Seattle Indian Health Board, where we are contracted by the Indian Health Service to provide primary care, social services, and traditional Indian medicine for people living in Seattle, American Indians, and Alaska Natives. We are an IHS contracted facility. And in that sense, since this administration has started, we have had our money frozen off and on. We've had threats to whether or not we're going to be receiving funding. We have lost the connections to people who provide us our technical assistance to ensure that our grants are carried out appropriately. And so we've suffered in that sense. We are not receiving the prepaid benefit that we have through our treaty and trust responsibilities that the federal government is supposed to provide to us to ensure the health, wellness, and safety of our relatives that we serve every single day. And that's a deep concern. And so we have actively partnered with organizations like the National Indian Health Board to fight for our rights, to fight for what our relatives survived so that our people today could thrive. We are fighting for that actively now, and we have seen the administration respond when Indian country has come together and pushed in these coalitions that we are all a part of. And I am so grateful and proud of our tribal leadership and our organizational leadership who have really stepped up. In my other role as the director of the Urban Indian Health Institute, a tribal epidemiology center, which we focus on data for Indigenous people by Indigenous people. And our access to that data has been limited. We know that the administration removed data sets, information that we need on our relatives in order to understand where their health and well-being is so that we can do better for them in the future. And not all of that has been restored. Again, this is a violation of treaty and trust responsibility, and the education that is needed for this administration is one that we are actively working on, but we're just in the beginning. But I do want to say, despite all of those threats, the joy, the collaboration, and what Indian country has done in stepping up together is something that continues to give me incredible hope.
Thanks, Abigail. Dean, what are your reflections?
Well, I want to thank Indian Country Today for having me on, Weson Yahweh, and I'm very honored to be part of this powerful warrior panel. I don't believe the secretary is negotiating in good faith. He has a record riddled in contradictions, falsehoods. To me, he can't be trusted. He erodes trust under the disguise of trying to restore it. Treating him as a serious partner for Indian country could have devastating consequences. I'm really overwhelmed, let me just say that, with what he's done with vaccines and our vaccine immunization committee. So, this is our biggest public health tool that we have in fighting many infectious diseases. And this is being something that's undermined. So I have some serious concerns about what's going on now at the department.
As with a lot of Native people and tribal leaders, and I know one of the big topics, you all brought up was also the public health. And, since the start of this new administration, the American public health infrastructure has been dismantled from the top down, from the CDC Healthy Tribes program, scientists being let go, and again, like you said, vaccines. And I guess this question's for Abigail first. For listeners who haven't heard about the CDC Healthy Tribes program, can you explain what happened there and how this impacts Native people?
Yeah, and so I'm actually an awardee under the Healthy Tribes program. I have multiple programs under that, both for locally in the area I'm in Seattle, and also for the work that I do nationally with the 41 urban Indian health programs across the United States. And so the Healthy Tribes program encompassed a multitude of different grants. We're all focused on chronic disease prevention, so things like diabetes, heart disease, obesity, and we were doing it through our own cultural ways. And so Healthy Tribes as a program established in the CDC is again the upholding of treaty and trust responsibility. We have a prepaid benefit to ensure the health and well-being of our people. And as a result of the harm of colonialism, we know that many of our people suffer from health disparities like diabetes. So putting that program in the CDC was the federal government upholding treaty and trust responsibility. What has happened is they have laid off a majority of the staff. They're talking about reorganizing and shifting for my programs right now. And I've talked to people across the country. We don't have the same resources that we had to coordinate with the CDC to ensure that we were fulfilling all of our financial obligations, that we could make shifts and adjustments to our programs. For example, we just hosted a large number of, it was a little over 20 folks from across urban Indian health programs, where we trained them on how to implement traditional foods into their programs and into their clinics. Those are essential to our people's healing. It's all about taking care of our people and the community. And so while it may be dissolving across the nation right now, we are going to fight to uphold it. We will not let it be done in silence, and we won't let them do it, honestly. But the thing that we have to hold on to is we have it in our own communities and we maintain it. And so we need to hold on to that cultural value of taking care of our people. And we saw it during COVID-19. American Indians and Alaska Natives, we did it best and we will continue to do so, but we will fight for treaty and trust obligations to be upheld, and restoring the Healthy Tribes program at the CDC is one of my number one priorities.
And then, Dean, you worked at the CDC for 20 years. So whether offices or programs in the CDC have been affected by this administration that we cannot see right now?
Well, for one, they were supposed to have a tribal consultation meeting in the winter. That has never happened. The other thing I do know is that there were tribal liaisons at each center. Those have been eliminated. Many of the offices had a lot of programs that were going on in Indian country, like the Injury Center, which is the second leading cause of death in our communities. That program has been eliminated. But as far as CDC, I keep hearing insights throughout the whole agency. And my favorite one, when what that was going on when this reorganization happened, was that several senior leaders actually called me and said, you know, Dean, I've been let go from my position, but I've been offered a job to work in Indian Health Service in Alaska. So, talk about a smack in the face, or kind of degrading our Indigenous health system. It was just awful on so many levels.
In terms of the IHS bringing in more people who are health leaders and I guess reassigning them, have you all heard any updates about that? Because I know from understand a lot of them are being offered reassignments in like Montana, Albuquerque, just across Indian country. Is that Dean, you said it's pretty much like a slap in the face, and I know I read reports saying it's an insult, but there's also the other, part of that narrative that there are open positions and we need people in there. I mean, how do you argue that? And any of you who have insights into that?
So on average, the IHS across facilities has an incredible number of vacancies. In some places, it's as high as 25%. And so while this was a misguided effort to fill those vacancies, what we should have done is and these folks should have had the opportunity, instead of being told, they should have had the opportunity to say, these are other opportunities, not show up for work here in 3 or 4 weeks. Otherwise, you don't have a job, which is what some of them were actually told. And so we are seeing people shift into positions that they don't have the qualifications for. So while we have the vacancies and Indian country has been fighting to have them filled, we need appropriately qualified individuals to fill those positions. And that is what we are fighting for. Not just somebody who honestly is probably a great person, doesn't know anything about this job, but is just trying to keep feeding their families. So yeah, they may relocate. And for others, they lost their jobs. And that means that they and their families are suffering. And nobody in this country, regardless of race or ethnicity, deserves to have that happen to them and to have their livelihood taken.
It was definitely a misguided way to fill those vacancies. There's, like she said, it's upwards 20, in some facilities it's 35% vacancy rate. And those are everything from your doctors, your physicians, your nurses, all the way down to your coders, your billers, the sanitation folks who are cleaning the facilities. And we're in a system that is already at its breaking point. I mean, we can't ask folks who are just completely unqualified to come into a system and just fill a spot when we need qualified physicians, qualified nurses, qualified folks to come in and fill these vacancies. And, right now, it was reported about 43% of IHS facilities are one provider away from having to shut their doors. So if there's a sick day, if someone calls out sick in some of these facilities, a physician, emergency room physician, they have to shut down the hospital. There's no way they can stay open. That risk accreditation issues, that risk, think about, a grandmother who is starting in early stages of a heart attack, who is coming to an emergency room for her services. The closest hospital is now 2 hours away. There's no way she's going to be able to live. Those are the realities that we are facing. So it's really about our accreditation, maintaining safe facilities, and keeping the doors open.
And all these systems are really interconnected because I think, if you have doctors come out sick, way to prevent that are vaccines, and that's being attacked, and chronic illnesses, it's just very ironic. And I think a lot of this has me thinking about these tribal epidemiology centers you all brought up earlier. This program was authorized by Congress in 1996, and they were formally given public health authority in 2010. And this would give them, access to information for disease surveillance. But what's going on with the CDC? I'm curious if the tribal epidemiology centers will step it up, or if they should be relied on more, because they're technically an extension of sovereignty. And Abigail, since you work with a lot of them, are there an underutilized resource now, or can you provide insight into this?
Yeah, so I direct a tribal epidemiology center. There are 12 in the nation. They fall into all of the IHS regions, and all of the epidemiology centers are overseen by the tribes in their area through a tribal board. So they are an extension of tribal sovereignty. I operate the Urban Indian Health Institute, which is overseen by a board of directors that represent urban Indian organizations and individuals. And so mine is the only one with national scope for the more than 75% of us that live off reservation. And we're just tribal people living off reservation, and it doesn't mean treaty and trust obligations ended because we stepped off our reservations. And so the Tribal Epidemiology Centers, if you don't know what epidemiology is, epidemiology is the look at, the Western perspective sees it as a study of disease over time. Like, what are the trends? Where can we intervene? What are things that happened? But from an Indigenous perspective, it's a study of our thriving over time. We all hold the stories 5, 10, 20 generations back of how our tribes and our families did more than survive. We thrived in so many ways. So that's what the Tribal Epidemiology Centers do, is uphold an Indigenous perspective on how we gather data and information. We do it for the good and well-being of our people, and is overseen by our tribal communities. We are underfunded and under-resourced, and our funding, like everybody else's, is currently under threats. And so things like the dissolving of the Healthy Tribes program had a section of it just for the epidemiology centers to provide resources and support on health and wellness within Indian country. So we are actually suffering as a result of the changes in the administration, and we do and step in and step up wherever we can, but we are also limited as a result of this. So I also want people to know that rather than resources for individuals, which you can go to our websites and download things on like measles and stuff like that, we really do provide the resources and support for the tribes at a larger scale. And while there's individual resources, it really is a support for tribes and urban Indian organizations. And I'd like to see the administration increase. And again, in upholding treaty and trust responsibility, if they're going to be cutting the CDC, they should be increasing the funding to tribal epidemiology centers.
I agree with that. I mean, I said they're an extension of sovereignty, all those treaty and trust responsibilities. And even like tied to that too is, I think, the question of biomedical research. Dean, I'm like wondering, how important is biomedical research for Native people and tribal nations, and how will these cuts affect them?
Biomedical research is essential for our tribal nations because we don't really have a lot of research or study in our communities. But I wanted to step back for a second on that question. CDC does an NHANES study every year or every 2 years throughout the whole country. And this is where you get the average statistics, average height, average weight. And they do different racial ethnic group NHANES studies. My first day at CDC, 25 years ago, my first question was, well, where is our Indigenous, or where is our American Indian, Alaska Native, Native Hawaiian, and Haines? And we still haven't had one. We haven't had an NHANES study, so we can't even tell, like, what are the averages when it comes to our Native populations, right? We don't even really have a baseline to really build off of when it comes to that. So that's critical. But biomedical research for everything to really get understanding, how, diabetes is really impacting our communities. Heart disease and stroke is really impacting our communities, chronic liver disease, and a lot of other social determinants of health. All of this, because we really don't have answers, because we really haven't done research. And the other research that we really need to do is to assess our cultural traditions and their impact on health. We know that our culture works in healing, and we know that a lot of things that we do in our communities are very effective to addressing trauma and reducing disparities. But we need to prove that to these NIH scientists. And that's what research that I think that we need to really engage in when it comes to, making an impact for our tribal communities.
And there's also vaccines, and then measles happening. I mean, RFK fired and replaced the CDC vaccine advisory committee that lacks experience. And my first thought about this was, what would this move do for Native people, especially elders and children? And could IHS even still distribute and administer vaccines because they're technically housed in a federal agency? And then, like you said, Dean, I think of all the Native people who are in cities or in urban areas, maybe away from IHS clinics or urban Indian health programs. I mean, what do you all think? What are your thoughts about this?
First, I want to say vaccines that are approved in this country right now have gone through extensive testing, clinical trials, and are FDA approved for safety and well-being. And so there are some vaccines, and everybody needs to look to see if they have certain allergies associated with them. And that's where you spend time and talk to your primary care provider. But these vaccines are safe, they are essential, and they are absolutely key to the health and well-being of our communities. So the Urban Indian Health Institute, they just came in this week. I recently wrote a little kids coloring book with one of my youth interns on the importance of getting vaccines. And I remember sitting with him and he's like, "What? These vaccines do what?" And he goes out and tells all his friends, like, have you gotten HPV? Have you gotten all your vaccines? We need to provide this education, and that public health information is key to what the CDC does, is providing up-to-date, scientifically based, evidence-based information. If we lose that access, we are going to see outbreaks of disease we have not seen in 100 years. And in fact, the county that I'm in, I was just notified yesterday, we're in the middle of a measles outbreak here. We just had 2 more diagnosed on Monday. That is an incredible risk and one that is not necessary. So we call on the administration and Secretary Kennedy to uphold the most basics of evidence-based scientific practice to ensure that there's public health information and access to vaccines. It is essential to the health and well-being of our community. We know what happened 100 years ago, 200 years ago, 300 years ago in regards to this kind of disease. Our people were decimated, and I refuse to let that happen again.
And if I could add to that, vaccines do not cause autism. There are many studies throughout the world looking at hundreds of thousands of kids, over 1 million of kids in these studies, and not one link to autism. Because all these vaccine deniers go to the famous Wakefield study, which was totally corrupt, totally non-scientific, only had something like 12 kids when they were trying to make a link to vaccines and autism, and the study was actually funded by anti-vaxxers. So, and that's what everybody's basing all of their knowledge regarding vaccines on. But, I did a lot of measles work when I was in Ethiopia. And let me tell you, like Abigail said, these are totally preventable. I would be in one village and I would see 50 to 100 kids screaming and crying in pain because of measles. And this is totally preventable given the vaccine. I would go over to the next village and the community would be quiet and the kids would be playing because everybody was vaccinated. There's no need in this day and time for us to have any measles cases here in the United States. And to have conversations with these anti-vaxxers, it's becoming ridiculous. We need these vaccines. And also, most importantly, and this specifically applies to our Indigenous communities, we have a lot of immune compromised people, like we had pre-existing conditions for COVID-19. Our populations need these vaccines in order to stay healthy and vibrant. So, yeah.
Okay, thanks, Dean. AC, did you have anything to add?
I think Abigail and Dean hit it on the head, but I think one thing we always got to consider that it sometimes it's hard for our people to trust the government, and I get it. Historically, it is, we do not have the greatest history with the government telling us to do anything. But you should trust the providers who are in your hospitals who've been taking care of you for years. You should trust the nurses, those who have the experience, who are telling you that taking this vaccine isn't just about you. It is an act of love to protect your community, your elders, your relatives. It's not just about how it protects you. So if anything, really just take that step, because as American Alaska Native people, we are expected to take care of one another. And this is an expectation in our community, and our ancestors and relatives have fought so long for us to have healthy communities and healthy people. And, we really need folks to take these vaccines and make sure that we can continue to be healthy.
Is there evidence that the Trump administration has violated, ignored, and not fulfilled any contractual obligations between the federal government and the tribes?
The Trump administration, I know we're talking a lot about the Trump, and we've seen much more significant changes than we've seen in several previous administrations. But there has never been an administration in this country that has fully fulfilled the treaty and trust obligations. They are in constant violation of those contracts. But I do want to say that health in Indian country and upholding of treaty and trust responsibility is not partisan. It's not a Democrat. It's not about a Republican. It's about fulfilling those contracts and the treaties, which are legal documents that have, there's a recent 2021 district court decision that said that American Indians and Alaska Natives have a legal right to physician-led quality health care. We have that. It's just not being upheld.
Well, thank you all today, all for your time today. It's all the time we have. I know we barely scratched the surface, but I just want to hit again for all of your time and energy and your work you do.
Thank you so much for having us.
And that's a slice of our Indigenous world. For all the latest, visit ictnews.org. From all of us in the newsroom, stay safe, my relatives.